Hello, my name is Dr. Amador, Dr. Javier Amador, and welcome to my first attempt to get caught up on the letters I've been receiving, both from people who have read my books and fans of Bethany Frankel's show. I have many more uh, postings to the blog and emails than I can possibly get to. However, we have chosen two this week that really cover a lot of the same problems, a lot of the same themes that I'm hearing from a number of people who are writing to me. And I will confess, most of the people writing are women. We do have some men. I don't think that's a negative statement about men in particular. I think that's a consequence of so many people that do buy my books and watch Bethany's show are women. I've certainly worked with a lot of men in therapy. I'm very hopeful for my sex, and I know that there are men who work very hard to improve themselves. So we'll work hard to get some men's questions up there as well. But right now, we really wanted to focus on the ones that are ones that relate to many of the questions I'm getting. So I'm going to start with Connie from Cincinnati, who's complaining that she's lost interest in having sex with her boyfriend. It's interesting. Loss of libido, which is the technical term for losing interest in sex, is caused by all sorts of things. What Connie identifies in her question really are a couple of factors that caught my attention. One was that she's angry, and that's probably the most obvious one. If you read her question, you'll see that she's getting more and more upset that he's focused on her being very career-driven, and that would be one way to describe what she tells us about. But also that they go out late at night. They only see each other on weekends. They go out very late. So what I typically say to couples, or if I'm working with somebody individually, is try and identify those factors that interfere with your loss of interest in sex, those factors that we're very well aware of. So one would be, if you're going out, and especially if you're going out and drinking, try coming home earlier, try lowering the alcohol consumption, and I don't know if they are drinking or not, and see if that makes a difference. Frankly, the suspect that is highest on my list, given the short question that we received, is that she's angry. And learning how to talk about her anger, about her husband, rather her boyfriend's criticism of her focus on her work, her depression about her work, is a really important topic. And that's going to be the next question I get to in just a moment. But before I do, I want to point out that Connie also complains about being depressed. And if this is going on for a couple of weeks or longer, you have to start worrying about clinical depression. And when I say worry, it's not that you can't do something about it. It's just that you have to do something different than what you would normally do for a normal depression. Everybody gets depressed. And if I get sad or blue, I might take a nap. Lots of people will say, well, I deserve a drink. I'm going to have a drink. You feel better for a moment. And there are lots of home remedies for normal depression. But a clinical depression is a constellation of symptoms, things like depressed mood, loss of interest in sex, inability to concentrate, sleep problems, weight changes, usually it's weight loss, but sometimes weight gain. All of these can be symptoms of depression, the clinical form of depression, when they hang together for a couple of weeks or longer. So Connie, you may want to look at that as well, and if you think that's part of what's going on, seek some professional help and see if a diagnosis is in fact relevant, and then you can do something about that. And that's one of the biggest causes of loss of libido in my experience, is undiagnosed or unrecognized clinical depression.